if it is passed, what do we do as a state? What do we do as citizens? Do we send representatives in 2010 that can bring back the law? Because my understanding is that a lot of this stuff is not going to take place for a couple of election cycles, so that we do have the opportunity to maybe, you know, change it. And then also about states' rights. I keep hearing about the 10th Amendment, that the states has rights, and also if we can opt out, I heard that there was penalties for states that opt out. So if you could answer that.
Sure. Well, first and foremost, if I believe that this will continue to be, the vote will continue to be pushed off until they have enough to pass the House. And that's what's happened in the course of the last week. They were hoping to vote on this bill earlier in the week, as early as Wednesday. That has been continually pushed off, and it's because they don't have the votes. So I understand that the President is going to be meeting with the House member, the House Democrat caucus today. Depending on how that meeting goes, was going to dictate either the meeting tonight, the vote tonight at 6 o'clock, or that was going to be pushed off. What can we do if it passes? It still obviously has to go through the Senate, but you can vote in 2010 because this wouldn't take effect until 2013. And I would tell you this, if I'm your member of Congress, I'd file legislation to repeal this bill. And I'd also advocate that any member of Congress who votes for it signs on to it as someone who actually has to take those benefits. Yes?
So if they don't have the votes to pass this, I mean, I'm sending emails and phone calls and whatever. I mean, what can we do now to, I mean, if there's any way, it's better to stop it than to let it
Right,
go
I
through.
agree.
Is there anything else we can do?
I think we need to continue to convey to our delegation how, if you oppose it, I think you need to tell your members of the delegation that. Absolutely. I happened to be in Washington earlier this week when about 50,000 people came to a rally at the Capitol opposing this piece of legislation. There were lines around the buildings trying to get in to see members of Congress. Some members refused to see their own constituents. I can't imagine a government where the elected officials choose not to see their own constituents. But that's what was going on this week in Washington. And I think that people in our country are very frustrated and angry with the direction of this legislation. I think you need to continue to convey it. And that's why I talked earlier that I was disappointed that I don't think we've had a true ability and opportunity to do that in New Hampshire. I can tell you, when I put budgets out, every year I put a budget out, I have a public hearing. I don't invite, just the people that support it. It's open to the public. And believe me, many people who oppose my spending reforms and my tax cut proposals come to those public hearings. We've had as many as 2,000. But I am there. I let anyone who wants to speak, speak, because that's their right, that's their responsibility, and that is their opportunity to tell me whether they think I'm making the right decision or the wrong decision. And I've sat down with people on many occasions where I haven't originally agreed with a proposal, where we've sat down, we've worked on it, and we've made a proposal that makes sense. And we've got it passed by the Board of Mayor and Aldermen that sits in this room. And I think Americans are asking Congress to do the same thing. Most people seem to agree that they want some sort of reform. Again, if you have health care, quality health care, you're concerned likely about the cost. And if you don't have access to insurance or to health care, you want to have that access. I think most Americans agree that that's an area where we could work collectively to solve some issues. And in New Hampshire, it's very, very simple what you could do to make sure that people who don't have access to care gain access. But we're looking instead at specific reforms in areas of concern. We're looking at reforming the entire system. which I don't think is necessary, and I think most Americans believe is not necessary. But I would say you need to keep talking to your member of Congress. You need to keep talking to the delegation and making sure that they know what your position is. And let them know that you're a voter, and let them know that you're watching, and let them know what you would like to see in representation for you. Yes?
I really hate to see this bill pass because it's going to be on the backs of seniors. They're talking about, what, $400 million cuts in Medicare and the Medicare Advantage program, which a lot of seniors take advantage of. So really what I would really like to see is those people who cannot get insurance because they can't afford it, okay, or because they have a pre-existing condition, and that represents what, less than 10% of the people in the country that need insurance. Why not set up an assigned risk pool like they do for automobile insurance or anything else? And it would have to be subsidized. It would be a lot less costly than that thing. And let them get insurance in that name. Second, able to cross state lines, okay, to buy insurance. New Hampshire has a very strict and rigid set of guidelines for people who want to sell insurance in the state of New Hampshire. All policies have to cover certain things. It could be from massage therapy or whatever. Some young people want catastrophic coverage, and that's all they want. They can't buy it, not in this state, at a reduced rate. They could if it were allowed. And so I'd like to see that. And just to give a small example of what happens when government gets involved, I have COPD. I've had it for years. It was because I smoked too much when I was young. I have an inhaler that I use for emergency purposes. It's albuterol. And I also have Part D Medicare. When I used to purchase it, it was $6 and they paid $6. Then the government, in its infinite wisdom, decided to change the propellant in the inhaler because the propellant in the original inhaler, they said, contributed to global warming. So they changed it. Now my inhaler costs $60, and the Part D insurance doesn't cover any of it because they never added it. So that's just an example. But we got to get this thing beat. There's absolutely no way we can let it pass. Thank you.
Well, I think allowing people have talked a lot about how we purchase auto insurance and why can't we replicate that, duplicate it into the health insurance industry, and I think we can. I think that the state line should not be a border for you to buy insurance. But there's a multifaceted problem here. In the state of New Hampshire, we're losing carriers. That is a problem that our legislators need to address here in New Hampshire, coupled with the fact that federal regulations aren't allowing certain access outside of state lines. It again puts the consumer at a disadvantage, at a very clear and distinct financial disadvantage and a care disadvantage. And that needs to change. And I think, again, when you talk with people in New Hampshire who say, here's the 2 or 3 things that you could do, that's the kind of legislation that I'd like to see your representative filing. And saying, here are the things that I'm doing to try to convince the other members of Congress it makes sense for New Hampshire, and I suspect that it would make sense for most other states as well. But those positions have not been brought forward, at least by our member. And I think it's because this is the legislation that the leadership is looking to pass. I was reading some articles this morning, and Nancy Pelosi had stated that she wants this to pass so bad that she's willing to lose members of Congress over it. And while I admire someone's conviction to an ideal, it's not the ideal that the American public is conveying.